I want to talk about the silent killer called sepsis. As a board-certified personal injury lawyer that focuses my practice on medical malpractice cases, I have seen firsthand how devastating sepsis can be when medical professionals fail to treat infections timely. Sepsis is a life and limb-threatening condition that requires immediate and accurate medical attention. When a healthcare provider fails to meet the standard of care and stop sepsis, the consequences can be catastrophic. Hello, I'm Matt Powell, and this is my video where I'm going to explain sepsis and medical malpractice. If you or a loved one is a victim of medical malpractice and has suffered a loss of life or the amputation of a limb after an infection, I will explain what happened and what you can do about it within your legal rights. First, let me explain what sepsis is. Sepsis occurs when the body's immune response to an infection spirals out of control, causing a widespread inflammation, tissue damage, and organ failure. Sepsis can be caused from something minor, such as a cut, or after a surgery that develops an infection. Common symptoms of sepsis are infection on the skin, and when these symptoms get worse, they may include fever, rapid heartbeat, and difficulty breathing and confusion, as well as extreme discomfort. What's dangerous is sepsis symptoms can escalate quickly, like dominoes falling over. One medical error after another. This is why healthcare professionals must make a timely diagnosis and start the right types of treatments immediately. Here's a simple explanation for sepsis medical malpractice. Medical malpractice occurs when a healthcare provider's treatment falls below the standard of care, which is negligence. And this breach of care results in harm to a patient. In sepsis cases, what commonly happens is a patient has an infection and either the doctors fail to diagnose the beginning of sepsis, or they realize there's an infection and treat the infection, but don't take the next critical step and identify what is the cause of the infection leading to the sepsis. So let me break this down a little bit more. The first preventable error is the delayed diagnosis or misdiagnosis of sepsis, which is a failure to recognize early signs of sepsis, and this results in the second preventable error, delayed treatment, that allows the infection to become severe, and this increases the risk of complications or even the death of a patient. Now, delayed treatment of sepsis may be caused by running the wrong test and/or administering the wrong medications, or failing to prescribe the right antibiotics promptly, or not using intensive medical treatments to stop sepsis. And the third preventable error is the failure to identify and stop the cause of the infection. Many doctors keep treating the symptoms, but they don't take the time to identify what's causing the infection. The doctors sadly chase after the symptoms of infection while the cause of the infection continues to worsen until the sepsis sets in and the body begins shutting down the blood to the extremities. For example, following the surgery, the patient develops a fever and rapid heart rate, and the symptoms are dismissed as minor issues. When the fever and the rapid heart rate turn out to be early signs of sepsis, which are not addressed, the symptoms will quickly intensify. As the sepsis worsens, the blood becomes unable to carry enough oxygen. This leads to the patient's extremities suffering, and the tissue in their toes, feet, legs, finger, and hands start to die, which is medical malpractice. In the above real example, what happened is the patient had a cervical fusion surgery, and unfortunately, there was some bacteria that infected the bone. Because the infection was in the bone and behind the metal hardware that was implanted in the surgery, the antibiotics could not reach the source of the infection, causing the proliferation of the infection to go on. Sadly, the doctors kept treating the symptoms when they should have removed the hardware and the infected bone. As a result of the infection being allowed to continue, despite the antibiotic treatment, the patient's condition worsened and they had to have both legs amputated and the fingers off of both of their hands removed. Another example was a patient who had a kidney stone that blocked their ureter. The doctor sadly failed to find the cause of her infection, the kidney stone, and as a result, they just kept treating her symptoms, regretfully causing the infection to rage on until causing a loss of limbs and organ damage. Unless the doctors find the cause of the infection, they allow the infection to rage on, causing catastrophic damages to their patient. If and when the doctors look for the cause of the infection and they stop the infection, then and only then will the antibiotic treatment work and save the patients. Let me switch gears now and discuss bringing a sepsis medical malpractice case. We must establish 3 key elements. First is negligence, proving that one or more of the healthcare providers failed to meet the standard of care expected in their field, like timely diagnosing sepsis, identifying the cause of the infection, or delaying proper treatment of sepsis. Second, causation, which involves showing that the negligence directly caused or worsened the patient's sepsis condition. And third, damages, which involves proving the patient suffered harm physically, emotionally, and/or financially as a result of the sepsis. Sepsis malpractice requires me to use expert testimony to explain how the healthcare providers failed to treat the patient by following the standard of care, and to explain how timely treatments would have prevented amputations or death. And it's important to understand that sepsis-related malpractice cases are complex, so proving negligence involves detailed analysis of medical records, understanding clinical protocols, and consulting with top medical experts in their fields. This is another reason why it is crucial to work with a board-certified injury lawyer who focuses on medical malpractice cases. One with experience, knowledge, and resources to navigate the complicated intricacies of bringing a case to court. Experience enables a board-certified civil trial lawyer to build a strong case for you or your loved one to make up for the serious losses and damages suffered by the medical malpractice victims. What can you do if you suspect you or a loved one has suffered from medical malpractice due to a sepsis-related incident? First, call an experienced medical malpractice trial lawyer who is board certified, who can fully investigate what happened. Second, try to document everything. Create a detailed timeline of symptoms and interaction with healthcare providers. And third, do not wait. Time is not on your side. Because medical malpractice cases are so complex, any delay can cause important evidence to be lost or even worse, destroyed. At MattLaw, when we suspect sepsis malpractice, we immediately form a plan to gather all of the evidence and find the best experts to help us identify the negligence of the healthcare providers that caused you or a loved one to suffer catastrophic damages. We work closely with our clients to make sure that we understand what you and your loved ones are dealing with. We have the experience and we have the connections to top experts and the resources to consult with the best medical experts in the field in order to hold the negligent parties accountable. We also have the experts to help us quantify the enormous damages caused to you and your family by the failures of the healthcare providers who just didn't have the time, who didn't listen, who wouldn't run the right tests, all of which caused the preventable damages that you have suffered. If you suspect that you or a loved one have been a victim of medical malpractice involving sepsis, don't wait to call us at MattLaw, because the sooner you do, the better chances are that we have to preserve the medical evidence and build a strong case to make you a full recovery for your damages. Contact my office today for a free consultation so you can understand your rights and take action to seek justice and protect others from similar harm. Thank you for watching, and if you have more questions, please subscribe and watch my other videos that help explain your rights if you have a question regarding a legal personal injury matter. Don't forget, just call me, Matt Powell, 813-222-2222.